Hi, I'm Dr. Sanil Nigalye, and I'm here to talk to you about the difference between mini dental implants and regular dental implants. There are two basic types of dental implants that doctors are using for full arch dental implant procedures and for single tooth replacement. One is a mini dental implant and the other is standard root form dental implants. What's a mini dental implant? Also known as a narrow diameter implant, is exactly that, a lower diameter implant, usually about 1.8 to 2.7 millimeters.
Now that's thin.
Where possible, a standard root form dental implant is better for stability and function. A standard root form implant is anywhere between 3 to 6 millimeters in diameter. That's closer to the actual root of your tooth. You may be asking, why were mini dental implants created in the first place? Well, mini dental implants do work well for patients that don't have sufficient bone and need retention for a full or partial denture. The biggest problem that we see with mini implants is that their diameters are too narrow and they break, and they don't have enough strength in order to support normal function. It's simple. Mini implants are not indicated for single tooth replacement. They do not provide enough support and stability for the crown that sits on top of them. The biggest advantage of a standard root form implant is that they have an internal connection and they're versatile in terms of what types of attachments can be placed into them. Some attachments can provide better stability and retention of the prosthesis than others. An internal connection is a more secure connection, and the attachment that goes into it will in turn be more secure. Standard root form implants typically have more upfront costs, but there are less costs downstream for replacement. For more information on dental implants and how they can restore your smile, call our office for a consultation.